If you have noticed increased hair loss during the pandemic, you're not alone. Dr. Pari Oza joins us with more. Good morning.
Good morning.
So a lot of this, I understand, is stress related.
Absolutely. There's many different causes of hair loss, including medications and medical problems, but definitely a big cause of hair loss is prolonged stress, kind of like what we experienced during a pandemic.
And how do you know when it's a point where it's like, okay, there's something wrong here and I need to get help? Because are there things that you can do if you're experiencing this?
Yes. If you are noticing that you have excessive hair loss, which is abnormal for you, or if you are also experiencing other symptoms like just not feeling well, things are not quite right, or noticing certain things on your scalp like rashes or symptoms like all of a sudden your scalp is more itchy than normal, then you should definitely see your doctor. There's a good chance that your hair loss may be caused by a medical condition that can be treated.
And what is it, typically one medical condition that's doing this, or are there many?
The causes of hair loss are numerous. Specifically right now, if we're talking about stress-related hair loss, it's called telogen effluvium. And this is caused by many hair follicles being in the resting phase of the hair cycle, and therefore there's more shedding than is expected. The good news in this condition is that the hair follicles are still present, and there is a great chance of the hair growing back, and it should be just a temporary condition.
Okay, so maybe when things get back to normal again, we're going to see more cut. I wonder if it's maybe like a hibernation thing, like you can't get in for a cut in some areas right now, so your hair's just waiting.
Yeah, and that's a good point too. Like while we're at home, we want to make sure that we are doing certain things that can decrease our chances of having this type of hair loss. And that includes just making sure you're eating right. We know that having certain nutritional deficiencies like iron deficiency can increase the risk of hair falling out. Also, if you're managing your stress better, then you're physiologically not going to be impacted by it, therefore less chance of hair falling out. And then certain habits that we have, especially right now when we're mainly at home with our hair tied up, tying our hair tightly in ponytails and braids for a prolonged period of time can cause traction and damage to hair follicles as well. So you want to just be mindful of that and give your hair a break and some love.
Okay, now the term that I couldn't even write it down while you said it, but the term for the condition, is it something that that can be treated, or and does it cause, like, do you just notice more hairs on your brushes, or does it fall out in clumps?
So the specific condition of hair loss caused by a stressor is called telogen effluvium. You don't need to know that term, but normally or be able to pronounce it even. But normally what you will notice is just exactly what you said, Annette, more hair on your brush when you're combing it. You may notice that your ponytail is smaller than it used to be, but you will not be seeing any actual bald spots per se in this condition. And it is treatable and reversible. And unfortunately, there isn't a magic pill or a magic solution. We wish there were, but it's definitely something you should talk to your family doctor about to help you get back to your baseline sooner than later.
Okay, I'm sure lots of people are going, whew, I thought it was just me, but okay, if it's something that's caused by stressors, then this is a bit of a relief. Dr. Pari, thank you very much for coming on the show today.
It was my pleasure. Have a great day.
Your hair looks awesome, by the way.
A lot of volumizing.